Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs via primary care, telemedicine, concierge medicine, through my Amazon best-selling book Vitality, as well as COVID-19 testing and vaccines. Good afternoon, ladies and gentlemen. May is Melanoma Awareness Month. So in honor of melanoma awareness, we're just going to share a little bit of information with you as a continuation of our House Calls episode this week with CBS News that aired on Monday. We will share that broadcast later today so you guys can take a look at that. And if you do have other questions, we do that show every Monday this segment every Monday at 6:30 a.m. If you have medical questions, definitely email us those questions. So let's talk about melanoma. Why do we care about it? Well, the number one reason is because skin cancer is the most common cancer that there is, period. Melanoma accounts for a great deal of this, and although it's not as common as the other skin cancers, it definitely is the most dangerous because it can spread so quickly. 85% of cases of melanoma are associated with UV radiation exposure from the sun. What causes that, you might ask? Okay, so what does it have to do with the sun? The exposure to the sun can cause you to have damage to your DNA, or what we call mutations or changes in those skin cells that cause abnormal growth of those cells. And what cancer is really is an overgrowth, overgrowth of abnormal cells. So that's the cause. What are the risk factors that we want to talk about? Number one risk factor we want to mention today is family history. Family history is so important. This is something, forgive the airplanes in the background, this is something that very commonly comes up and it runs in families. There's a very strong genetic component. For that reason, that is one area of prevention that we have, so that if you know that you have family history, hi Kim, how are you? That's my sister in Chicago. If you know that you have family history of melanoma, then we know that we need to make sure that you're screening and watching your skin and getting those exams that we need annually by the dermatologist. We'll get to that in just a moment. But 1 in every 10 patients that is positive for melanoma has a relative that also has melanoma, just to give you an idea of how strong that affiliation is with family history. In addition to that, other risk factors include your skin type and even skin color. Fair skin or people with light eyes are at increased risk for developing melanoma. In addition to that, hair color, light hair color, red hair color, freckling is also affiliated with an increased risk of melanoma. In addition to that, the number of moles. Having many moles puts you at increased risk for melanoma as well. With the moles, and you may ask, okay, so what's the deal with the moles? We want to make sure that you're paying attention to the moles that you have on your body. I know that I have a lot of moles all over my body. So I'm constantly looking at those on a regular basis, when you shower and you're checking yourself out, to make sure that there are no areas that are concerning for you, okay? We'll talk about that in a little bit as well. Next risk factor we want to talk about is UV exposure to the sunlight or the tanning bed. You can get damage to your skin from either of those things. And there's a very distinct correlation between unprotected exposure and melanoma. So in other words, if you go out into the sun and you don't protect yourself with enough sunscreen, and we want to make sure we get the one with the SPF of at least 30, and that's the sun protective factor of at least 30 when you pick up sunscreen. But if you go without that, there is a correlation between melanoma and diagnosis and the amount of exposure to the sun. In addition to that, we want to talk about something else that puts you at increased risk is not just the UV exposure to the sun, but if you've had a history of frequent sunburns when you're a child. That's why it's important for kids to put on sunscreen when they go outside and play. And that's whether you're Caucasian, whether you're African American. I want to dispel a myth here. Sometimes people think that people that are of color or African American culture do not get cancer. You can get skin cancer no matter what your culture is. It is definitely more common in some cultures than others, but African Americans can get skin cancer, so we want to make sure that we pay attention to these things as well. In addition to that, a lot of sunburns as a child, a lot of sun exposure and cumulative exposure. So in other words, if you're someone that works in the sun all day, we definitely want to make sure that you get that SPF 30 sunscreen and that you wear that every day on your face as well as on your arms, legs, etc. Right? Now let's talk about prevention. What can we do to prevent it, right? what can we do prevention-wise, which is part of the reason why we do these Facebook Lives, is to help increase prevention and to just awareness to things so that we know the things that we can do every day at home to help prevent certain disease processes. One of the things we want to talk about, again, family history. Number one, knowing your family history. Number two, making sure that if you do have family history of melanoma, that you are making sure that you've made your annual appointment with your dermatologist to make sure that we are getting an exam where the dermatologist is looking at you, where you've, disrobed, and they look at all the moles all over your body to make sure that there are no areas to be concerned about. That is something that you have done annually, and I definitely recommend that everyone have that done. Talk with your physician to find out how often you need to go. There's some people that have strong family history that may need to go more than just once a year. Number two, one of the things that can help for people that have family history of melanoma, children having skin checks with families that have a strong family history. Speak to your pediatrician about whether or not that needs to be, especially if you have family history. In addition to that, we want to talk about protection from UV rays. We've already talked about the sunscreen and the sun protective factor of at least 30 for each sunscreen that you buy. We want to make sure we apply that. In addition to that, when you go outside, some of the things that we can do to help protect ourselves: wearing a hat, that's going to protect from some rays of the sun for getting into your face. Wearing sunglasses will also help to protect it, as well as wearing a long sleeve shirt if you have to be outside to do lawn work, yard work, or etc. So those are some of the things that we can do. Again, we already talked about doing the dermatology visits and making sure you have those done annually. Now, how do we treat melanoma if you get it? There are several different ways that you can treat it. That is determined by the stage of the cancer, and the stage of the cancer is determined by how far the cancer has spread. That is something that will be done in the consultation with the dermatologist and plus or minus oncologist that will be treating you. The different ways are complete removal with surgery, chemo, or radiation, or a combination of those things. The doctor has to determine what is best for your particular case once you're diagnosed. So that's all we had to share today. Thank you guys for tuning in. And let's see. Stacy. Hey, Stacy, how are you? She said that she didn't process that moles were a risk factor. Yes, moles are a risk factor for melanoma and for skin cancer. What you want to do, though, when you look at the moles, is watch for changes. If you have a mole, and let's say the mole is dark in color, let's say you notice that, oh, I feel like the mole's getting lighter and lighter in color, right? So that would be a mole that would be concerning and worth a call to the dermatologist and consultation and say, hey, I want to come in for a visit. I see a little bit of a change in this mole. Is this something to be concerned about? Having that annual visit with the dermatologist will also ensure that if there is a change with the mole, if they've seen it annually, they know when it gets to a point to be something concerning that we have to remove it, take a sample, or figure out whether or not this is something that needs to be removed, okay? And or sent to pathology to determine the diagnosis. So that's all we had to share with you guys today. Again, May is Melanoma Awareness Month. We will post the link from the segment that we did on CBS 42 News on Monday, bringing awareness to melanoma as well. You are welcome. Hi, Ms. Merritt. Thank you for joining us. I hope you guys are having a great day. We are continuing to do COVID vaccines at the Birmingham International Airport. If you're in need of a COVID vaccine, definitely go on our website and schedule an appointment. We will have that on our social media page. You can actually just click on the link and schedule there, first or second doses, and we have Pfizer, okay? Other than that, if you guys are in need of primary care, definitely give us a call for an appointment. That's all we had to share today. Hope everyone's having a happy Wednesday. We're halfway through the week. Hope this information was helpful. If it is, if you'll please share it with your family and friends. That's all we had to share. Have a good day. Bye-bye.